Hey, my name is Delaney Anderson, and the character I chose for this assignment is Riley Anderson from the movie Inside Out, and I have diagnosed her with dissociative identity disorder. Riley is the main character of the movie Inside Out and is an 11-year-old girl who has just moved with her parents from Minnesota to San Francisco. Inside Out portrays Riley's personality by depicting each of her emotions joy, sadness, anger, fear, and disgust as individual characters with their own emotions and personality traits that control Riley with a control panel inside of her brain. Dissociative identity disorder is a mental condition in which a patient experiences a separation in their personality into multiple distinct identities, known as alters, that have their own personalities, thoughts, emotions, and oftentimes memories associated with dissociative amnesia. Dissociative identity disorder, despite it being present in all cultures as we would describe it in the United States, is not diagnosed in all cultures because in many cultures it is considered to be, rather than a disorder, a natural trauma response that does not need to be labeled or treated. And in the United States, it is also a contested topic, with some believing that dissociative identity disorder is overdiagnosed and that dissociative identity disorder may be a lot less common than we see it. And due to these disagreements among scholars, the social atmosphere includes stigmas that people with dissociative identity disorder might be faking their diverged personalities. Riley's possible dissociative identity disorder symptoms include the individuality of each of her emotions as their own separate characters that are not always working together in conjunction, contrary to the synchronized emotion characters of her parents, which are also displayed in the film and are working towards a common goal. Riley's emotion characters, however, are completely distinct whenever they are controlling her, and she completely changes from emotion to emotion in personality and behavior. Additionally, when joy and sadness are able to be completely lost from her brain during the movie, Riley's entire personality was changed because she lost her main emotion that was controlling her, which would be joy. And this is similar to dissociative identity disorder because it represents the switching of alters, the switching of personalities that changes their entire actions and personality. However, Riley does not experience any amnesia when switching between the different alters or personalities, and that is something that is very significant because the vast majority of dissociative identity disorder patients experience dissociative amnesia. Dissociative identity disorder does not have a cure, and most treatment or therapy related to the disorder is in order to guide patients to greater congruity and to coexist with these different alters in their brain rather than to remove these alters or cure the separation altogether. Ethical concerns for this treatment are that not every scientist, not every psychologist believes that dissociative identity disorder is a psychological disorder that needs to be treated, and not every person believes that it is the best and most ethical thing to encourage the patient to accept their alters as separate from them, which is what that disorder, that like treatment for the disorder would encourage. Riley's dissociative identity disorder symptoms cause her a lot of distress in the film. And as a result of them, she quits her hockey team and nearly runs away from home due to the distress that it is causing her. And that is often the case with people with dissociative identity disorder, that it is something that causes them distress. It is something that is not necessarily welcome. And I would say, although it is not a perfectly accurate portrayal, because the filmmakers had no intention of portraying dissociative identity disorder, the vast distinction between each of the different emotions as personalities within Riley's brain is an accurate depiction of the differences between alters in a person with dissociative identity disorder. And then portrayal of this disorder in the film does influence the way that people interact with dissociative identity disorder and the way that we view it. And the film treating these different emotions as something that Riley needed to accept does fit in with the therapy model of teaching people with dissociative identity disorder that their different personalities and alters are something that they need to accept. And so that may make that a more common thing. And in other cultures, I would still consider Riley as having dissociative identity disorder, but she would be less likely to be diagnosed. And these are my sources.